Question 1. Performance analysis shows a certified gastroenterology registered nurse is caring for a patient with moderate to severe Crohn's disease who is also being managed for non-alcoholic steatohepatitis, NASH. The patient's physician is considering initiating a novel biologic therapy for the Crohn's disease, which has shown promise in early trials for modulating immune responses that can impact both gut inflammation and liver fibrosis. Which of the following approaches best reflects the CGRN role in optimizing care for this complex patient? Option A. Advise the patient to seek information about the novel biologic therapy from online patient forums and social media groups to gather diverse perspectives on its effectiveness and side effects. Option B. Proactively research and critically evaluate the latest peer-reviewed literature and evidence-based guidelines regarding the efficacy, safety, and monitoring requirements of the proposed novel biologic therapy, specifically considering its dual impact on IBD and NASH, and collaborate with the interdisciplinary team to ensure the patient is fully informed and involved in shared decision-making. Option C. Rely on the gastroenterologist's initial recommendation for the novel biologic therapy and focus solely on administering the medication as prescribed, assuming the physician has considered all patient factors. Option D. Prioritize educating the patient about the novel biologic therapy's benefits for Crohn's disease and defer any discussion about its potential effects on NASH to the hepatologist, as the primary indication is IBD. The correct answer is B. Proactively research and critically evaluate the latest peer-reviewed literature and evidence-based guidelines regarding the efficacy, safety, and monitoring requirements of the proposed novel biologic therapy, specifically considering its dual impact on IBD and NASH, and collaborate with the interdisciplinary team to ensure the patient is fully informed and involved in shared decision-making. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified gastroenterology registered nurse, CGRN, to integrate rapidly evolving knowledge of novel therapies for inflammatory bowel disease, IBD, and liver disease into patient care. The complexity arises from the need to understand the mechanisms of action, potential benefits, risks, and monitoring requirements of these new treatments, while also ensuring patient safety and adherence to evidence-based practice and regulatory guidelines. Balancing patient-specific needs with emerging research and clinical trial data demands critical thinking and a commitment to continuous learning. Correct approach analysis. The correct approach represents best professional practice by prioritizing a comprehensive, multidisciplinary, and patient-centered strategy. This involves consulting current, peer-reviewed literature and evidence-based guidelines from reputable professional organizations, e.g., American College of Gastroenterology, American Association for the Study of Liver Diseases, to inform treatment decisions. It also necessitates close collaboration with the gastroenterologist and hepatologist to ensure a unified care plan, open communication with the patient about treatment options, risks, and benefits, and diligent monitoring for efficacy and adverse events. This aligns with the ethical principles of beneficence, non-maleficence, and patient autonomy, as well as regulatory requirements for competent and safe nursing practice. Incorrect approach is analysis. An approach that relies solely on anecdotal evidence or personal experience without consulting current research or guidelines is professionally unacceptable. This fails to meet the standard of care and can lead to suboptimal or harmful patient outcomes, violating the principle of beneficence. It also disregards the regulatory expectation for nurses to practice based on current scientific knowledge and evidence. An approach that disregards the patient's preferences or understanding of novel therapies is ethically flawed. This undermines patient autonomy and informed consent, which are fundamental rights and regulatory requirements. It also fails to acknowledge the patient as a partner in their care, potentially leading to poor adherence and dissatisfaction. An approach that focuses exclusively on the IBD aspect of novel therapies, while neglecting potential implications for coexisting liver disease, or vice versa, is incomplete and potentially dangerous. This demonstrates a lack of holistic patient assessment and can result in overlooking critical drug interactions or contraindications, violating the principle of non-maleficence and failing to meet the comprehensive care standards expected of a CGRN. Professional reasoning. Professionals should adopt a systematic approach to integrating novel therapies. This begins with a thorough understanding of the patient's condition, including the specific type and severity of IBD and any coexisting liver disease. Next, they should actively seek out and critically appraise the latest evidence from peer-reviewed journals and professional society guidelines. Collaboration with the interdisciplinary team is paramount to develop a tailored treatment plan. Patient education and shared decision-making are essential components, ensuring the patient understands the rationale, expected outcomes, and potential risks of the chosen therapy. Finally, ongoing monitoring for efficacy, safety, and patient well-being is crucial, with prompt adjustments to the care plan as needed. Question 2. The performance metrics show a consistent pattern of delayed diagnosis in patients presenting with chronic diarrhea and malabsorption. A biopsy specimen from the small intestine of a representative patient reveals villous atrophy, crypt hyperplasia, and an increased number of intraepithelial lymphocytes, EAL. Which of the following histological findings, when considered in conjunction with these observations, most strongly supports a diagnosis of celiac disease? Option A. The presence of goblet cell hyperplasia and eosinophilic infiltration in the lamina propria. Option B. A significant increase in the density of intraepithelial lymphocytes, often exceeding 40 per 100 enterocytes, with a characteristic T-cell receptor gene rearrangement. Option C. Dilated lymphatic channels within the submucosa and increased plasma cells in the lamina propria. Option D. Focal areas of pseudostratified columnar epithelium with mucin depletion. The correct answer is A. The presence of goblet cell hyperplasia and eosinophilic infiltration in the lamina propria. Explanation: scenario analysis. This scenario is professionally challenging because it requires the certified gastroenterology registered nurse, CGRN, to integrate knowledge of histological cellular structures with clinical presentation and diagnostic interpretation. Misinterpreting histological findings can lead to incorrect diagnoses, inappropriate treatment plans, and potentially adverse patient outcomes. The CGRN must exercise careful judgment in correlating microscopic evidence with macroscopic observations and patient symptoms, adhering strictly to established diagnostic criteria and best practices within the scope of their certification. Correct approach analysis. The correct approach demonstrates best professional practice by accurately identifying the characteristic histological features of the condition. This involves recognizing the specific cellular morphology, tissue architecture, and any pathological changes that are pathognomonic or highly suggestive of the diagnosis. This aligns with the CGRN responsibility to contribute to accurate diagnosis and patient management by understanding the underlying pathophysiology at a cellular level, as supported by professional standards of practice that emphasize evidence-based care and diagnostic accuracy. Incorrect approaches analysis. An incorrect approach that focuses on superficial or nonspecific cellular changes fails to meet the diagnostic threshold. This represents a failure to apply specialized knowledge expected of a CGRN, potentially leading to misdiagnosis and delayed or incorrect treatment. Ethically, this could be considered a breach of competence. Another incorrect approach that misattributes features to a different condition, even if superficially similar, demonstrates a lack of detailed histological understanding. This can result in significant diagnostic errors, patient harm, and a deviation from the standard of care. Regulatory frameworks for nursing practice mandate accurate assessment and interpretation of diagnostic information. An approach that ignores the presence of specific inflammatory markers or cellular infiltrates, or misinterprets their significance, also constitutes a failure. This indicates a deficiency in recognizing key histological indicators, which is a core competency for a CGRN involved in interpreting diagnostic data. This could lead to a failure to identify the true pathology, impacting patient care and potentially violating professional conduct standards. Professional reasoning. Professionals should approach such scenarios by systematically reviewing the provided histological images or descriptions. This involves comparing the observed features against known histological patterns of common and relevant gastrointestinal pathologies. Structured approach, such as considering cellular atypia, inflammatory cell types and distribution, glandular architecture, and the presence of specific inclusions or abnormalities, is crucial. When in doubt, consulting with a pathologist or senior clinician, and cross-referencing with established histological atlases and diagnostic guidelines is a vital part of the decision-making process to ensure diagnostic accuracy and patient safety. Question 3. Strategic planning requires a certified gastroenterology registered nurse to anticipate and manage potential complications in patients with a history of gastrointestinal issues. A 68-year-old male with a known history of peptic ulcer disease presents to the emergency department with sudden onset of hematemesis and melena. His blood pressure is 90/50 mmHg, heart rate is 110 bpm, and he appears pale and diaphoretic. What is the most appropriate initial nursing management strategy? Option A. Initiate intravenous fluid resuscitation with normal saline, establish 2 large-bore intravenous lines, obtain vital signs, and notify the physician immediately. Option B. Focus on obtaining a detailed dietary history and administer an oral antacid. Option C. Administer prescribed proton pump inhibitor and schedule an upper endoscopy for the following day. Option D. Begin a thorough gastrointestinal symptom questionnaire and document all patient complaints before initiating any interventions. The correct answer is A. Initiate intravenous fluid resuscitation with normal saline, establish 2 large-bore intravenous lines, obtain vital signs, and notify the physician immediately. Explanation. Scenario analysis. This case presents a common yet critical scenario in gastroenterology. A patient with a history of peptic ulcer disease experiencing acute gastrointestinal bleeding. The challenge lies in rapidly assessing the severity of bleeding, identifying the likely cause, and initiating appropriate management while considering the patient's underlying conditions and potential complications. The nurse must balance immediate interventions with long-term management strategies, all within the scope of practice and regulatory guidelines for a certified gastroenterology registered nurse. Correct approach analysis. The correct approach prioritizes immediate hemodynamic stabilization, thorough assessment, and prompt communication with the physician. This aligns with established nursing standards of care and regulatory frameworks that mandate nurses to assess, monitor, and intervene in acute situations. The emphasis on vital signs, intravenous access, fluid resuscitation, and laboratory monitoring directly addresses the immediate threat of hypovolemic shock. Furthermore, initiating a focused history and physical examination to identify potential causes of bleeding is crucial for guiding further diagnostic and therapeutic decisions, as per the scope of practice for advanced registered nurses in gastroenterology. Prompt notification of the physician ensures collaborative care and timely initiation of definitive treatments, such as endoscopy. Incorrect approaches analysis. One incorrect approach would be to solely focus on administering prescribed medications without a comprehensive assessment of the patient's hemodynamic status. This fails to address the immediate life-threatening consequences of significant blood loss and could delay critical interventions like fluid resuscitation, violating the nursing duty to assess and monitor patient stability. It also overlooks the need for a differential diagnosis to guide treatment. Another incorrect approach would be to delay notifying the physician until a complete diagnostic workup is performed by the nurse. This deviates from collaborative practice models and regulatory expectations that require timely communication of critical patient changes to the physician for prompt medical management. It places an undue burden on the nurse to make independent diagnostic decisions beyond their scope and delays potentially life-saving interventions. A third incorrect approach might involve administering antacids or proton pump inhibitors without first assessing the patient's hemodynamic stability and identifying the likely source of bleeding. While these medications are often part of the management of GI bleeding, they are adjunctive therapies and should not precede the critical steps of stabilization and assessment. This approach prioritizes symptomatic relief over addressing the underlying cause and immediate physiological compromise. Professional reasoning. Professionals should employ a systematic approach to patient care, beginning with a rapid assessment of ABC's airway, breathing, circulation, and hemodynamic stability. This is followed by a focused history and physical examination to gather relevant data. Collaboration with the physician is paramount, involving clear and concise communication of findings and concerns. The decision-making process should be guided by evidence-based practice guidelines, institutional policies, and the nurse's scope of practice, always prioritizing patient safety and optimal outcomes. Question 4. The monitoring system demonstrates a sustained increase in intragastric pressure and a decrease in the frequency of coordinated peristaltic waves in the small intestine of a patient who underwent a partial gastrectomy 2 days ago. considering the structural and functional alterations expected post-surgery, which interpretation most accurately reflects a potential complication related to the gastrointestinal tract's structure and function. Option A. The increased intragastric pressure is a normal physiological response to increased fluid intake, and the decreased peristalsis is unrelated to the surgery. Option B. The findings suggest a developing postoperative ileus, indicating a temporary cessation of normal intestinal motility due to surgical manipulation and anesthesia. Option C. The decreased peristaltic waves are a sign of hypermotility, and the intragastric pressure increase is due to a dietary intolerance. Option D. The monitoring data indicates a successful surgical outcome, with improved gastric emptying and normal intestinal function. The correct answer is B. The findings suggest a developing postoperative ileus, indicating a temporary cessation of normal intestinal motility due to surgical manipulation and anesthesia. Explanation: scenario analysis. This scenario is professionally challenging because it requires the certified gastroenterology registered nurse, CGRN, to interpret complex physiological data in the context of a patient's underlying gastrointestinal (GI) pathology. The challenge lies in distinguishing between normal physiological responses and those indicative of a worsening condition or complication, necessitating a deep understanding of GI tract structure and function. Accurate interpretation is critical for timely intervention, patient safety, and adherence to best practices in gastroenterology nursing. Correct approach analysis. The correct approach involves correlating the observed monitoring data with the known structural and functional characteristics of the GI tract in the context of the patient's specific condition. This means understanding how peristalsis, mucosal integrity, sphincter function, and absorptive processes are affected by diseases like inflammatory bowel disease or post-surgical changes. By applying this knowledge, CGRN can accurately assess the significance of the monitoring findings, such as identifying abnormal bowel sounds as potential indicators of ileus or increased motility, or recognizing changes in gastric emptying as a sign of delayed gastric emptying. This approach aligns with the professional responsibility to provide evidence-based, patient-centered care, ensuring that interventions are appropriate and effective, and that patient outcomes are optimized. It directly reflects the core competencies expected of a CGRN in managing complex GI patients. Incorrect approach is analysis. One incorrect approach would be to solely focus on the numerical values of the monitoring system without considering the patient's clinical presentation or the underlying GI pathology. This fails to acknowledge that physiological parameters can vary significantly between individuals and in different disease states. For example, a slightly elevated heart rate might be a normal response to pain or anxiety, rather than a sign of hypovolemia, if not interpreted in context. This approach risks misinterpreting data, leading to unnecessary interventions or delayed treatment of actual complications. Ethically, it represents a failure to provide individualized care and a deviation from the standard of care that requires holistic patient assessment. Another incorrect approach would be to rely on anecdotal experience or generalized nursing knowledge, without specific application to the GI tract structure and function. While experience is valuable, it must be grounded in scientific principles and current evidence. For instance, assuming all abdominal distension is due to gas without considering potential mechanical obstruction or fluid accumulation would be a significant oversight. This approach lacks the precision required for specialized care in gastroenterology and could lead to incorrect diagnoses and inappropriate management strategies, potentially harming the patient. It also fails to meet the professional expectation of continuous learning and application of specialized knowledge. A third incorrect approach would be to defer all interpretation and decision-making to the physician without independently analyzing the data. While collaboration is essential, the CGRN has a distinct role in monitoring, assessing, and reporting findings. Failing to perform an initial interpretation based on their specialized knowledge of GI structure and function abdicates a key nursing responsibility. This can lead to delays in communication and intervention, as the physician may not receive the most pertinent information in a timely manner. It also undervalues the CGRN expertise and contribution to the interdisciplinary care team, potentially impacting patient safety and care coordination. Professional reasoning. Professionals should employ a systematic approach that integrates data from the monitoring system with their comprehensive understanding of GI physiology and the patient-specific condition. This involves 1. Actively reviewing the monitoring data. 2. Recalling and applying knowledge of the normal structure and function of the relevant GI segment. 3. Considering how the patient's diagnosed pathology alters normal GI function. 4. Correlating the monitoring data with the patient's signs and symptoms. 5. Formulating a preliminary interpretation of the findings. 6. Communicating significant findings and interpretations to the interdisciplinary team, including the physician, for collaborative decision-making and further management. This process ensures that care is informed, precise, and patient-specific. Question 5. Implementation of a comprehensive patient assessment for a 55-year-old male presenting with acute, severe epigastric pain radiating to his back, accompanied by nausea and vomiting, requires the certified gastroenterology registered nurse to consider the primary anatomical structures involved. Which of the following anatomical considerations is most critical in guiding the initial differential diagnosis? Option A. The anatomical position of the spleen and its proximity to the stomach. Option B. The location of the diaphragm and its influence on diaphragmatic pleurisy. Option C. The common bile duct's passage through the head of the pancreas and its relationship to the sphincter of Oddi. Option D. The vascular supply of the jejunum and its role in mesenteric ischemia. The correct answer is C. The common bile duct's passage through the head of the pancreas and its relationship to the sphincter of Oddi. Explanation. Scenario analysis. This scenario presents a professional challenge in a clinical setting where a certified gastroenterology registered nurse, CGRN, must accurately assess a patient's condition based on their understanding of the anatomy and physiology of the liver, pancreas, and gallbladder. Misinterpreting symptoms related to these organs can lead to delayed or incorrect diagnoses, potentially causing harm to the patient. The challenge lies in applying theoretical knowledge of organ location, function, and common pathologies to a real-time clinical presentation, ensuring patient safety and adherence to best practices. Correct approach analysis. The correct approach involves a systematic assessment that correlates the patient's reported symptoms with the known anatomical locations and physiological functions of the liver, pancreas, and gallbladder. For instance, right upper quadrant pain is highly suggestive of gallbladder or liver pathology, while epigastric pain radiating to the back is more indicative of pancreatic issues. A CGRN expertise allows them to differentiate these presentations, guiding further diagnostic steps and treatment. This approach aligns with professional nursing standards of care, emphasizing thorough patient assessment, critical thinking, and evidence-based practice, all of which are foundational to safe and effective patient management within the scope of practice for a CGRN. Incorrect approach is analysis. An incorrect approach would be to focus solely on one organ without considering the interconnectedness of the hepatobiliary and pancreatic systems, or to dismiss symptoms without a comprehensive anatomical and physiological correlation. For example, attributing all upper abdominal pain solely to gastritis without considering referred pain patterns or the possibility of biliary colic would be a failure to apply comprehensive anatomical knowledge. Another incorrect approach would be to rely on anecdotal evidence or patient self-diagnosis rather than a systematic clinical evaluation. Such failures represent a deviation from the expected standard of care for a CGRN, potentially leading to diagnostic errors and compromised patient outcomes. Ethically, this would also constitute a breach of the nurse's duty to provide competent and individualized care. Professional reasoning. Professionals should employ a decision-making framework that begins with a detailed patient history, including the nature, location, and radiation of pain. This is followed by a focused physical examination, paying close attention to the specific anatomical landmarks of the liver, pancreas, and gallbladder. The nurse should then integrate this information with their knowledge of the pathophysiology of common diseases affecting these organs. If the presentation is unclear or suggests a serious condition, the framework dictates prompt consultation with a physician or advanced practice provider and the initiation of appropriate diagnostic tests. This systematic, knowledge-based approach ensures that patient care is both safe and effective, adhering to professional and ethical obligations. Question 6. Governance review demonstrates that a patient diagnosed with symptomatic cholelithiasis and acute cholecystitis is expressing significant anxiety and repeatedly asking for clarification regarding the proposed laparoscopic cholecystectomy. The patient states, "I'm just so scared. I don't know if I can go through with this." The nurse's primary responsibility in this situation is to: Option A. Proceed with the procedure as scheduled, reassuring the patient that the physician is highly skilled and that their anxiety is normal. Option B. Inform the patient that the decision to undergo surgery is solely the physician's and that the nurse cannot provide further input. Option C. Ensure the patient fully understands the procedure, its risks, benefits, and alternatives, and address their fears before proceeding with obtaining consent. Option D. Document the patient's anxiety and proceed with the surgery as ordered, assuming the physician has already obtained adequate informed consent. The correct answer is C. Ensure the patient fully understands the procedure, its risks, benefits, and alternatives, and address their fears before proceeding with obtaining consent. Explanation. Scenario analysis. This scenario presents a professional challenge due to the inherent conflict between patient autonomy and the nurse's duty to advocate for the patient's well-being, especially when the patient's decision-making capacity is potentially compromised by pain and anxiety related to a gallbladder disease diagnosis. The nurse must navigate the ethical principles of beneficence, acting in the patient's best interest, and respect for autonomy, honoring the patient's right to make decisions, while also adhering to professional nursing standards and institutional policies regarding informed consent and patient care. Correct approach analysis. The correct approach prioritizes patient safety and informed decision-making by taking the time to thoroughly explain the procedure, its risks and benefits, and alternative options. The nurse ensures the patient has the necessary information to provide truly informed consent. This aligns with the ethical principle of autonomy and the legal requirement for informed consent in healthcare. Furthermore, assessing the patient's understanding and addressing their concerns directly supports the principle of beneficence by ensuring the patient is making a decision that is in their best interest, free from undue pressure or misunderstanding. This approach upholds professional nursing standards by demonstrating patient advocacy and a commitment to ethical practice. Incorrect approaches analysis. One incorrect approach involves proceeding with the procedure without further clarification or assessment of the patient's understanding. This fails to uphold the principle of autonomy, as consent obtained under duress or without full comprehension is not valid. It also violates the nurse's duty of beneficence by potentially subjecting the patient to a procedure they do not fully understand or consent to, increasing the risk of adverse outcomes or patient dissatisfaction. This could also lead to legal ramifications for battery. Another incorrect approach is to dismiss the patient's concerns as mere anxiety and proceed with the procedure based on the physician's orders alone. This disregards the patient's subjective experience and their right to express doubts or seek further information. It prioritizes physician authority over patient autonomy and fails to acknowledge the nurse's role as a patient advocate. Ethically, this approach breaches the duty of care and respect for persons. A third incorrect approach is to inform the patient that the decision is solely the physician's and that the nurse cannot intervene. This abdicates the nurse's professional responsibility and ethical obligation to ensure patient understanding and advocate for their needs. Nurses are integral members of the healthcare team and have a duty to facilitate communication and ensure patient rights are protected, not to act as passive conduits of information. Professional reasoning. Professionals should employ a decision-making framework that begins with assessing the situation, identifying ethical principles at play, considering relevant professional standards and legal requirements, and then developing and evaluating potential courses of action. In this case, the framework would involve 1. Recognizing the potential for compromised consent due to patient distress. 2. Prioritizing patient education and assessment of understanding. 3. Collaborating with the physician to address patient concerns. 4. Ensuring that consent is voluntary, informed, and documented appropriately before proceeding. This systematic approach ensures that patient rights and well-being are paramount. Question 7. Investigation of a patient's persistent complaints of abdominal discomfort and irregular bowel movements reveals a potential need for a diagnostic test to assess gastrointestinal motility. The patient expresses significant apprehension about undergoing the procedure, citing fear of increased pain and discomfort. As the certified gastroenterology registered nurse, how should you ethically and professionally address this situation? Option A. Agree to postpone the diagnostic test indefinitely based on the patient's initial expression of discomfort, without further exploration of their concerns or the clinical implications. Option B. Proceed with the diagnostic test as ordered by the physician, reassuring the patient that it will be over quickly and minimizing their expressed concerns. Option C. Engage in a detailed discussion with the patient, explaining the rationale for the test, its potential benefits in diagnosing the cause of their symptoms, and addressing their specific fears and concerns to facilitate an informed decision. Option D. Inform the patient that the test is mandatory for their diagnosis and that their refusal will have negative consequences for their treatment plan. The correct answer is C. Engage in a detailed discussion with the patient, explaining the rationale for the test, its potential benefits in diagnosing the cause of their symptoms, and addressing their specific fears and concerns to facilitate an informed decision. Explanation. Scenario analysis. This scenario presents a professional challenge due to the conflict between a patient's expressed wishes and the nurse's clinical judgment regarding the necessity of a diagnostic intervention for gastrointestinal motility. The patient's desire to avoid further discomfort, potentially stemming from a misunderstanding of the procedure's importance or a fear of exacerbating their symptoms, clashes with the nurse's responsibility to advocate for appropriate care and ensure patient safety and optimal outcomes. The nurse must navigate this ethical tightrope, balancing patient autonomy with beneficence and non-maleficence, all while adhering to professional standards of care. Correct approach analysis. The correct approach involves a thorough, empathetic, and educational dialogue with the patient. This aligns with the ethical principles of informed consent and patient autonomy, which are foundational in nursing practice and are reinforced by regulatory frameworks governing patient rights and healthcare provider responsibilities. By explaining the rationale behind the proposed investigation, its potential benefits in diagnosing the underlying cause of their motility issues, and the risks and alternatives, the nurse empowers the patient to make an informed decision. This approach respects the patient's right to self-determination, while ensuring they have the necessary information to understand the implications of their choices. It also upholds the nurse's duty of beneficence by seeking to identify and address the root cause of the patient's symptoms, ultimately aiming for improved health outcomes. This aligns with the core tenets of patient-centered care and professional nursing ethics. Incorrect approaches analysis. One incorrect approach involves overriding the patient's expressed concerns and proceeding with the investigation without further discussion. This violates the principle of patient autonomy and informed consent. Regulatory guidelines and ethical codes mandate that patients have the right to refuse medical treatment, even if it is recommended by healthcare professionals. Failing to engage in a dialogue about the patient's fears and concerns constitutes a failure to respect their dignity and right to self-determination, potentially leading to a breach of trust and professional misconduct. Another incorrect approach is to dismiss the patient's concerns as simply being difficult or anxious, without attempting to understand the root cause of their reluctance. This demonstrates a lack of empathy and a failure to uphold the nurse's duty of care. Professional nursing standards require nurses to assess the patient holistically, which includes understanding their psychological and emotional state. Dismissing their concerns can lead to a breakdown in the therapeutic relationship and prevent the patient from receiving necessary care. Ethically, this approach can be seen as a form of paternalism, where the healthcare provider assumes they know what is best for the patient without adequate consideration of the patient's perspective. A third incorrect approach is to agree to forego the investigation solely based on the patient's initial reluctance without exploring the underlying reasons or offering alternative solutions or reassurances. While respecting patient wishes is crucial, nurses also have a responsibility to advocate for care that promotes the patient's well-being. Simply acquiescing without further exploration might mean missing a critical diagnostic opportunity, potentially leading to delayed treatment or worsening of the patient's condition. This could be seen as a failure in the nurse's duty of beneficence and non-maleficence, as it may not be in the patient's best interest to avoid a potentially crucial diagnostic step. Professional reasoning. When faced with a patient's reluctance to undergo a recommended diagnostic procedure related to gastrointestinal motility, a professional nurse should employ a structured decision-making process. This begins with active listening and empathetic inquiry to understand the patient's specific fears, concerns, or misunderstandings. Following this, the nurse should provide clear, concise, and patient-appropriate education about the purpose of the investigation, its expected benefits, potential risks, and available alternatives. This educational component is crucial for facilitating informed consent. The nurse should then collaboratively discuss the patient's preferences and concerns, seeking to address them directly and explore potential compromises or modifications to the procedure if clinically feasible. Throughout this process, the nurse must remain an advocate for the patient's well-being, ensuring that any decision made is truly informed and aligned with the patient's values and goals, while also upholding professional standards of care and regulatory requirements. Question 8. Process analysis reveals that a patient has just undergone an endoscopic retrograde cholangioppancreatography, ERP, and is being transferred to the recovery area. The nurse is tasked with ensuring the patient's immediate post-procedural safety and comfort. Which of the following nursing actions best reflects adherence to best practices and regulatory expectations for post-ERP care? Option A. Delegating the entire post-ERP monitoring and assessment to a nursing assistant. Option B. Administering prescribed opioid analgesia for reported abdominal discomfort without further assessment. Option C. Discharging the patient home immediately after the procedure based on their verbal assurance of feeling well. Option D. Performing a comprehensive head-to-toe physical assessment, including vital signs, abdominal palpation for tenderness, and monitoring for signs of bleeding or fever, and communicating any abnormal findings to the physician. The correct answer is B. Administering prescribed opioid analgesia for reported abdominal discomfort without further assessment. Explanation: scenario analysis. This scenario presents a common challenge in gastroenterology nursing, managing patient care during and immediately after complex endoscopic procedures, specifically an ERP. The challenge lies in balancing the need for immediate post-procedural monitoring for potential complications, like pancreatitis, bleeding, or perforation, with the patient's comfort and the efficient turnover of resources. The nurse must possess a deep understanding of ERP-specific risks, patient anatomy, and the expected recovery trajectory, all while adhering to established protocols and physician orders. The critical judgment required involves recognizing subtle signs of deterioration versus expected post-procedural discomfort, and knowing when to escalate care. Correct approach analysis. The correct approach emphasizes vigilant, direct patient observation and assessment for specific ERP-related complications, coupled with prompt communication with the physician. This aligns with the core ethical and professional responsibilities of a registered nurse, particularly in a specialized field like gastroenterology. Regulatory frameworks for nursing practice, such as those established by the American Nurses Association, ANA, Standards of Practice, and the Gastroenterology Nursing Certification Board, GNC competencies, mandate that nurses provide safe, competent, and individualized patient care. This includes continuous assessment, accurate documentation, and timely intervention. For ERP, this translates to monitoring vital signs, assessing for abdominal pain, nausea, vomiting, fever, and any signs of bleeding, as these are known potential adverse events. Promptly reporting any deviations from the expected recovery to the physician ensures timely management of complications, thereby upholding the principle of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach involves prioritizing patient comfort through immediate administration of pain medication, without a thorough assessment of the underlying cause of discomfort. This fails to recognize that pain can be an early indicator of a serious complication, such as pancreatitis or perforation. Ethically, this approach risks violating the principle of non-maleficence by potentially delaying the diagnosis and treatment of a life-threatening condition. Regulatory failure lies in deviating from the nursing process, which mandates assessment before intervention. Another incorrect approach is to rely solely on the patient's subjective report of feeling fine and discharging them without a comprehensive physical assessment and vital sign check. This neglects the nurse's professional responsibility to independently assess the patient's physiological status. Regulatory failure occurs by not adhering to established post-procedural care protocols, which typically require a period of observation and assessment before discharge, especially after an invasive procedure like ERP. This also breaches the duty of care. A third incorrect approach is to delegate the primary post-ERP assessment to an unlicensed assistive personnel, UAP, without direct RN oversight and validation of findings. While UAPs can assist with vital signs, the interpretation of these findings in the context of post-ERC recovery and the decision to escalate care remain the responsibility of the RN. Regulatory failure here involves improper delegation, which can lead to a breakdown in the chain of accountability and potentially compromise patient safety. Professional reasoning. Professionals should employ a systematic approach to post-procedural care. This begins with a thorough understanding of the specific procedure performed ERP, its associated risks, and the expected recovery course. The nursing process, assessment, diagnosis, planning, implementation, evaluation, is paramount. A comprehensive assessment, including vital signs, pain assessment, and physical examination for signs of complications, must precede any intervention. Communication with the physician should be based on objective findings and clinical judgment. If there is any doubt or concern, escalation of care is always the safest and most ethical course of action. Adherence to institutional policies and procedures, as well as professional nursing standards, provides the framework for safe and effective patient management. Question 9. The control framework reveals that a certified gastroenterology registered nurse is reviewing diagnostic data for a patient presenting with chronic heartburn and regurgitation. The nurse has access to both esophageal manometry and 24-hour ambulatory pH monitoring results. Which approach best reflects the nurse's professional responsibility in interpreting this data to guide patient management? Option A. Prioritizing the interpretation of the pH monitoring data, as it directly quantifies acid reflux events, and considering the manometry results only if the pH data is inconclusive. Option B. Correlating the findings from both the manometry and pH monitoring studies with the patient's reported symptoms and medical history to formulate a comprehensive assessment. Option C. Relying solely on the patient's subjective report of symptoms to determine the severity of their condition, using the diagnostic data primarily to confirm pre-existing assumptions. Option D. Focusing primarily on the manometry results to identify any esophageal motility abnormalities, assuming these are the root cause of the patient's symptoms, and deferring detailed pH analysis. The correct answer is B. Correlating the findings from both the manometry and pH monitoring studies with the patient's reported symptoms and medical history to formulate a comprehensive assessment. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified gastroenterology registered nurse, CGRN, involving the interpretation and application of manometry and pH monitoring data in a patient with suspected gastroesophageal reflux disease, GERD. The challenge lies in synthesizing complex physiological data with clinical presentation to formulate an accurate diagnosis and treatment plan, while adhering to established nursing standards of practice and regulatory guidelines. The nurse must navigate potential ambiguities in the data, consider individual patient factors, and ensure patient safety and optimal outcomes. Correct approach analysis. The correct approach involves a comprehensive review of the manometry and pH monitoring results in conjunction with the patient's reported symptoms, medical history, and physical examination findings. This holistic assessment allows the CGRN to identify patterns indicative of GERD, such as abnormal esophageal motility or significant acid reflux events, and correlate them with the patient's subjective experience. This aligns with the nursing process, emphasizing assessment, diagnosis, planning, implementation, and evaluation. Adherence to evidence-based practice guidelines for GERD management, as established by professional organizations and regulatory bodies governing nursing practice in the U.S., e.g., State Boards of Nursing, American Nurses Association standards, is paramount. This approach ensures that patient care is informed, individualized, and safe, leading to appropriate therapeutic interventions and improved patient outcomes. Incorrect approach is analysis. Focusing solely on the pH monitoring data without considering the manometry results or clinical context is an incomplete assessment. This could lead to misinterpretation of reflux events, potentially overlooking underlying motility disorders that contribute to or mimic GERD symptoms. Failure to conduct a thorough assessment violates the nursing standard of practice requiring comprehensive data collection and analysis. Interpreting the manometry data in isolation, without correlating it with the pH monitoring findings and the patient's symptoms, is also professionally unacceptable. Manometry assesses esophageal motility, which can be affected by various conditions, and its findings must be contextualized within the broader picture of reflux. Ignoring the pH data or the patient's subjective experience would be a significant breach of professional responsibility and could lead to an incorrect diagnosis and ineffective treatment. Relying exclusively on the patient's self-reported symptoms without objective data from manometry and pH monitoring is insufficient for a definitive diagnosis of GERD. While symptoms are crucial, objective diagnostic tools are necessary to confirm the diagnosis and guide management, especially in complex cases. This approach neglects the requirement for evidence-based practice and may lead to misdiagnosis or delayed appropriate treatment. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough and accurate assessment of all available data, including patient history, physical examination, and diagnostic test results. This involves critical thinking to synthesize information, identify potential diagnoses, and formulate a plan of care. Collaboration with the healthcare team, including physicians, is essential for complex cases. Adherence to professional standards of practice, ethical principles, and regulatory requirements ensures that patient care is safe, effective, and patient-centered. Continuous learning and staying updated on best practices in gastroenterology nursing are also vital. Question 10. Operational review demonstrates a patient presenting with severe abdominal pain, nausea, and vomiting. The nurse observes guarding and rebound tenderness. Considering the pathophysiology of gastrointestinal disorders, which of the following approaches best guides the initial assessment and management strategy? Option A. Focus on identifying the specific inflammatory mediators and cellular damage contributing to the patient's acute abdominal symptoms. Option B. Initiate intravenous fluids and analgesia to stabilize the patient before further investigation into the cause. Option C. Recommend a low-residue diet and antispasmodics to manage the symptom while awaiting further diagnostic results. Option D. Prioritize immediate administration of broad-spectrum antibiotics based on the presence of pain and vomiting. The correct answer is D. Prioritize immediate administration of broad-spectrum antibiotics based on the presence of pain and vomiting. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of accurately assessing the pathophysiology of gastrointestinal disorders in a patient presenting with acute symptoms. Misinterpreting the underlying mechanisms can lead to delayed or incorrect treatment, potentially exacerbating the patient's condition and impacting their prognosis. The nurse must integrate knowledge of cellular and molecular processes with clinical presentation to formulate a differential diagnosis and guide appropriate interventions. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's signs and symptoms, correlating them with known pathophysiological pathways of common gastrointestinal disorders. This includes considering factors such as inflammation, motility disturbances, malabsorption, and the role of specific pathogens or genetic predispositions. By focusing on the underlying cellular and molecular derangements, the nurse can identify the most probable diagnosis and anticipate potential complications, thereby ensuring timely and effective management aligned with best practices in gastroenterology nursing. This aligns with the professional responsibility to provide evidence-based care and maintain patient safety. Incorrect approach is analysis. One incorrect approach would be to solely rely on the patient's subjective reporting of symptoms without a thorough objective assessment and consideration of underlying pathophysiology. This fails to acknowledge the complexity of GI disorders and the potential for symptoms to be misleading or indicative of more serious underlying issues. Ethically, this approach could lead to a breach of the duty of care by not adequately investigating the patient's condition. Another incorrect approach would be to jump to a conclusion based on a single prominent symptom without exploring other potential contributing pathophysiological mechanisms. This oversimplification can lead to a misdiagnosis or a delayed diagnosis of a more serious condition. This violates the principle of thoroughness in patient assessment and can result in suboptimal patient outcomes. A further incorrect approach would be to focus on symptomatic relief without understanding the root cause of the patient's distress. While symptom management is important, it does not address the underlying disease process and can mask progression or complications. This is a failure to provide comprehensive care and can be considered a deviation from professional standards of practice. Professional reasoning. Professionals should employ a diagnostic reasoning process that begins with a comprehensive history and physical examination. This is followed by a critical analysis of the patient's signs and symptoms, linking them to potential pathophysiological mechanisms. The nurse should then consider differential diagnoses, prioritizing those that are most likely and most serious. This iterative process, informed by current knowledge of GI pathophysiology, guides the selection of appropriate diagnostic tests and therapeutic interventions, ensuring patient-centered and evidence-based care. Question 11. The analysis reveals that a 45-year-old patient presents with a 6-month history of intermittent abdominal pain, bloating, and altered bowel habits, specifically alternating between constipation and diarrhea. The patient expresses significant distress and states they have researched online and are convinced they have irritable bowel syndrome (IBS). They are requesting immediate treatment for IBS. As a certified gastroenterology registered nurse, what is the most appropriate initial nursing action? Option A. Reassure the patient that their symptoms are likely due to IBS based on their online research and proceed with lifestyle modification advice without further investigation. Option B. Order a comprehensive panel of advanced diagnostic imaging and laboratory tests to definitively rule out all possible gastrointestinal pathologies before considering IBS. Option C. Immediately prescribe over-the-counter medications for symptom relief as requested by the patient, based on their self-diagnosis of IBS. Option D. Initiate a detailed symptom assessment, including a review of potential red flag symptoms, and begin the process of applying validated diagnostic criteria for IBS, while educating the patient on the diagnostic pathway. Correct answer is D. Initiate a detailed symptom assessment, including a review of potential red flag symptoms, and begin the process of applying validated diagnostic criteria for IBS, while educating the patient on the diagnostic pathway. Explanation. Scenario analysis. This scenario presents a common challenge in gastroenterology nursing where a patient exhibits symptoms suggestive of irritable bowel syndrome, IBS, but the diagnostic process requires careful exclusion of other organic pathologies. The professional challenge lies in balancing the patient's subjective distress and the need for timely symptom management with the imperative to conduct a thorough and evidence-based diagnostic workup, adhering to established clinical guidelines and regulatory expectations for patient care. Misinterpreting symptoms or prematurely diagnosing IBS can lead to delayed diagnosis of serious conditions, patient dissatisfaction, and potential legal or professional repercussions. Correct approach analysis. The correct approach emphasizes a systematic and evidence-based diagnostic process. This aligns with the regulatory framework for nursing practice, which mandates that registered nurses provide care that is safe, effective, and based on current scientific knowledge and clinical standards. For IBS, this typically involves a detailed history, physical examination, and appropriate investigations to rule out red flags for other gastrointestinal diseases, e.g., inflammatory bowel disease, celiac disease, malignancy. The use of validated diagnostic criteria, such as the Rome criteria, is a cornerstone of best practice and ensures a standardized, reproducible diagnostic approach. This methodical process protects the patient by ensuring a comprehensive assessment and minimizes the risk of misdiagnosis, thereby upholding professional ethical obligations of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach involves immediately attributing all symptoms to IBS without a comprehensive workup. This violates regulatory expectations for thorough patient assessment and diagnostic diligence. Ethically, it fails the principle of non-maleficence by potentially overlooking serious underlying conditions. It also disregards established clinical guidelines for IBS diagnosis, which explicitly require the exclusion of other diseases. Another incorrect approach is to rely solely on patient self-diagnosis or anecdotal evidence without professional medical evaluation. This is professionally unacceptable as it bypasses the nurse's role in applying clinical judgment and adhering to evidence-based practice. Regulatory frameworks expect nurses to guide patients through the diagnostic process, not to abdicate this responsibility. Ethically, this approach can lead to patient harm through delayed or incorrect treatment. A third incorrect approach might involve ordering a battery of expensive and potentially unnecessary tests without a clear diagnostic rationale, driven by patient demand or fear of missing something. While thoroughness is important, this approach can be inefficient, costly, and may not align with evidence-based guidelines for IBS workup, which often advocate for a stepwise approach based on symptom presentation and risk factors. Regulatory bodies often scrutinize resource utilization, and an unguided approach to testing can be seen as a failure in professional stewardship. Professional reasoning. When faced with a patient presenting with symptoms suggestive of IBS, the professional decision-making process should begin with a comprehensive history and physical examination. This should include a detailed assessment of symptom characteristics, duration, severity, and the presence of any red flag symptoms, e.g., rectal bleeding, unintentional weight loss, anemia, nocturnal symptoms, family history of GI cancer. Based on this initial assessment, the nurse, in collaboration with the physician, will determine the necessity and type of further investigations, adhering to established diagnostic algorithms for IBS and considering differential diagnoses. The use of validated diagnostic criteria and a stepwise approach to investigations, guided by clinical evidence and patient-specific factors, is paramount. Continuous patient education and shared decision-making are also critical components of effective care. Question 12. The assessment process reveals a 65-year-old male patient presenting with chronic diarrhea, significant unintentional weight loss, and greasy, foul-smelling stools. He reports frequent abdominal cramping and bloating after meals. Considering the patient's presentation and the critical role of digestive enzymes in nutrient breakdown, which of the following is the most likely primary issue contributing to his symptoms? Option A. Reduced activity of lactase in the small intestine, causing lactose intolerance. Option B. Insufficient production of pancreatic lipase, leading to impaired fat digestion and absorption. Option C. Overproduction of gastric acid, leading to peptic ulcer disease. Option D. Impaired motility of the small intestine, resulting in rapid transit of food. Correct answer is B. Insufficient production of pancreatic lipase, leading to impaired fat digestion and absorption. Explanation. The assessment process reveals a patient experiencing symptoms suggestive of malabsorption. This scenario is professionally challenging because accurately identifying the underlying cause requires a nuanced understanding of digestive enzyme function and its impact on nutrient absorption. The nurse must differentiate between potential deficiencies and their clinical manifestations to guide appropriate diagnostic and therapeutic interventions. Careful judgment is required to avoid misdiagnosis, delayed treatment, and unnecessary patient distress. The correct approach represents best professional practice because it prioritizes a systematic, evidence-based evaluation of the patient's symptoms in relation to known digestive enzyme function. This aligns with the core principles of nursing practice, which mandate the application of scientific knowledge and critical thinking to patient care. Specifically, understanding the roles of pancreatic enzymes like amylase, lipase, and proteases, as well as intestinal enzymes, is crucial for interpreting symptoms such as steatorrhea, bloating, and weight loss. This approach ensures that interventions are targeted and effective, promoting optimal patient outcomes and adhering to professional standards of care. An incorrect approach that focuses solely on symptomatic relief without investigating the underlying enzymatic cause would be professionally unacceptable. This failure to identify the root cause could lead to continued malabsorption, nutrient deficiencies, and a decline in the patient's health status. Ethically, this represents a failure to provide comprehensive care and to act in the patient's best interest. Another incorrect approach that involves empirical treatment with broad-spectrum digestive enzyme supplements without a clear diagnosis is also problematic. This could mask underlying conditions, lead to inappropriate dosing, and potentially cause adverse effects. It bypasses the essential diagnostic process and deviates from evidence-based practice. The professional decision-making process for similar situations should involve a thorough patient history, including dietary habits and previous gastrointestinal issues. This should be followed by a comprehensive physical examination. Based on these findings, the nurse should collaborate with the healthcare team to order relevant diagnostic tests, such as stool studies for fecal elastase or fat content, and potentially blood tests to assess for specific nutrient deficiencies. Interpretation of these results should be done in conjunction with an understanding of digestive enzyme physiology to formulate a targeted treatment plan. Question 13. Research into the impact of a novel proton pump inhibitor, PPI, on the intestinal absorption of fat-soluble vitamins, A, D, E, has yielded statistically significant findings indicating a reduction in their absorption rates in a controlled study. As a certified gastroenterology registered nurse, how should you approach the clinical implications of this research for your patients currently prescribed this PPI? Option A. Inform patients that the research is preliminary and likely not relevant to their individual health, advising them to continue their current medication without concern. Option B. Focus solely on the statistical significance of the findings, assuming any reduction in absorption, however small, warrants immediate vitamin supplementation for all patients. Option C. Immediately discontinue the PPI for all patients prescribed it, as the research indicates a negative impact on essential nutrient absorption. Option D. Critically evaluate the study's methodology, sample size, duration, and the magnitude of the observed reduction in vitamin absorption to determine its clinical significance for your patient population, and consult relevant clinical guidelines and physician colleagues. The correct answer is D. Critically evaluate the study's methodology, sample size, duration, and the magnitude of the observed reduction in vitamin absorption to determine its clinical significance for your patient population, and consult relevant clinical guidelines and physician colleagues. Explanation. Scenario analysis. This scenario presents a professional challenge for a certified gastroenterology registered nurse, CGRN, by requiring them to assess the impact of a specific medication on a fundamental physiological process, nutrient absorption, in the intestines. The challenge lies in translating a research finding into practical clinical judgment, considering the potential for adverse effects on patient well-being and adherence to evidence-based practice. The nurse must critically evaluate the research's implications for patient care, distinguishing between statistically significant findings and clinically meaningful outcomes, while adhering to the scope of practice and ethical obligations. Correct approach analysis. The correct approach involves a thorough evaluation of the research's methodology, statistical significance, and clinical relevance to the CGRN patient population. This aligns with the core principles of evidence-based practice, which mandates the integration of the best available research evidence with clinical expertise and patient values. Specifically, a CGRN is expected to understand how medications can influence gastrointestinal absorption processes, such as the transport of specific nutrients, e.g., fat-soluble vitamins, minerals, across the intestinal epithelium. The nurse must consider the potential for malabsorption, nutrient deficiencies, and subsequent clinical manifestations. This approach upholds the ethical duty to provide competent and safe patient care by ensuring that clinical decisions are informed by sound scientific evidence and are tailored to individual patient needs. It also reflects the professional responsibility to stay current with advancements in gastroenterology and pharmacology. Incorrect approaches analysis. One incorrect approach would be to immediately alter patient treatment plans based solely on a single research abstract without further investigation. This fails to acknowledge the rigorous process of scientific validation and peer review, and it bypasses the critical step of assessing the research's applicability to the specific patient context. Such an action could lead to unnecessary interventions, patient harm, or disruption of effective treatment regimens, violating the principle of non-maleficence and potentially contravening professional standards of care. Another incorrect approach would be to dismiss the research findings entirely due to a lack of immediate personal experience with the observed effect. This demonstrates a resistance to new evidence and a failure to engage with the evolving body of knowledge in gastroenterology. It neglects the CGRN responsibility to critically appraise and integrate relevant research into practice, potentially leading to the continued use of suboptimal treatments and failing to optimize patient outcomes. A third incorrect approach would be to focus solely on the statistical significance of the research, without considering its clinical implications. While statistical significance indicates a low probability that the observed effect is due to chance, it does not automatically translate to a clinically meaningful impact on patient health. A CGRN must be able to discern whether the observed changes in absorption are substantial enough to warrant clinical attention or intervention, thus ensuring that patient care is guided by practical and beneficial outcomes. Professional reasoning. When faced with new research findings, a CGRN should employ a systematic decision-making process. This begins with critically appraising the research for its validity, reliability, and generalizability. The nurse should then consider how the findings relate to their current patient population and individual patient circumstances, including existing comorbidities, current medications, and nutritional status. Consultation with colleagues, including physicians and dietitians, is often crucial for interpreting complex research and developing appropriate clinical strategies. The ultimate goal is to integrate evidence-based findings into patient care in a manner that is safe, effective, and individualized, always prioritizing patient well-being and adherence to professional ethical standards. Question 14. Examination of the data shows a patient presenting with jaundice, elevated ALT and AST levels, and a positive serological marker for hepatitis A. Stool studies reveal echolic pale stools and elevated bilirubin in the stool. Which of the following interpretations of this laboratory data is most clinically significant for guiding immediate nursing interventions and physician notification? Option A. The elevated liver enzymes and positive hepatitis A serology are sufficient to diagnose a chronic liver condition, and the stool abnormalities are unrelated and can be addressed separately at a later time. Option B. The echolic stools are a direct consequence of hepatitis A infection, and the elevated liver enzymes are a normal response to any viral illness, requiring no specific intervention related to these findings. Option C. The elevated liver enzymes and positive hepatitis A serology indicate acute viral hepatitis, while the echolic stools and elevated stool bilirubin suggest a concurrent obstructive process affecting bile flow, requiring further investigation into the cause of obstruction. Option D. The positive hepatitis A serology is the primary indicator of the patient's condition, and the other laboratory findings are secondary and require no immediate further interpretation beyond confirming the viral infection. The correct answer is C. The elevated liver enzymes and positive hepatitis A serology indicate acute viral hepatitis, while the echolic stools and elevated stool bilirubin suggest a concurrent obstructive process affecting bile flow, requiring further investigation into the cause of obstruction. Explanation. This scenario is professionally challenging because it requires the nurse to interpret a complex set of laboratory results in the context of a patient's presenting symptoms and potential underlying gastrointestinal conditions. The challenge lies in synthesizing information from liver function tests, stool studies, and serology to form a coherent clinical picture, while adhering to the strict regulatory framework governing nursing practice in the U.S., specifically as it pertains to the Certified Gastroenterology Registered Nurse (CGRN) certification. The nurse must demonstrate a deep understanding of how these tests are used diagnostically and prognostically, and how their interpretation informs patient care and management within the scope of their practice. The correct approach represents best professional practice because it prioritizes a comprehensive and integrated interpretation of all available laboratory data in conjunction with the patient's clinical presentation. This aligns with the CGRN certification's emphasis on advanced knowledge and skills in gastroenterology nursing, which includes the ability to critically analyze diagnostic information. Regulatory guidelines for registered nurses in the U.S. emphasize the importance of evidence-based practice and accurate assessment, which necessitates a holistic review of patient data. Ethical principles of beneficence and non-maleficence also mandate that nurses use all available information to provide the best possible care and avoid harm, which is achieved through thorough data analysis. An incorrect approach that focuses solely on one category of tests without considering the others would be a regulatory and ethical failure. For instance, interpreting liver function tests in isolation without considering stool studies might miss crucial information about an underlying infection or malabsorption contributing to liver dysfunction. This would violate the principle of comprehensive assessment and could lead to delayed or incorrect diagnosis and treatment, potentially causing patient harm. Similarly, focusing only on serology without correlating it with clinical signs and symptoms or other lab findings would be a failure to practice within the full scope of nursing assessment and critical thinking, potentially leading to misinterpretation of results and inappropriate nursing interventions. This could be seen as a deviation from professional standards of care, which are implicitly or explicitly guided by regulatory bodies. The professional decision-making process for similar situations should involve a systematic approach. 1. Review all available laboratory data, LFT, stool tests, serology, and identify any abnormal findings. 2. Correlate these findings with the patient's signs, symptoms, medical history, and current medications. 3. Consider the differential diagnoses suggested by the combined data. 4. Consult with the physician or advanced practice provider to discuss the findings and formulate a plan of care. 5. Document the assessment, interpretation, and plan clearly and accurately. This process ensures that the nurse is acting within their scope of practice, adhering to regulatory requirements, and upholding ethical obligations to the patient. Question 15. The evaluation methodology shows that a 45-year-old patient presents with intermittent, crampy abdominal pain, nausea, and a subjective feeling of bloating. The patient denies fever, vomiting, or significant changes in bowel habits, though they report occasional constipation. Considering the overview of gastrointestinal diseases, which initial nursing approach best facilitates accurate diagnosis and appropriate management? Option A. Immediately administer an antacid and advise the patient to monitor for symptom resolution, assuming a diagnosis of simple indigestion. Option B. Ask the patient to describe their perceived diagnosis based on online research and proceed with treatment accordingly. Option C. Focus solely on the reported constipation and recommend a high-fiber diet and increased fluid intake without further investigation. Option D. Conduct a comprehensive patient history focusing on the onset, duration, character, and aggravating/alleviating factors of the abdominal pain and bloating, followed by a focused physical examination of the abdomen. The correct answer is D. Conduct a comprehensive patient history focusing on the onset, duration, character, and aggravating/alleviating factors of the abdominal pain and bloating, followed by a focused physical examination of the abdomen. Explanation. Scenario analysis. This scenario presents a common challenge in gastroenterology nursing, differentiating between common gastrointestinal symptoms that can overlap across various conditions. The professional challenge lies in accurately identifying the underlying cause of the patient's discomfort to ensure appropriate and timely intervention, avoiding misdiagnosis and potential harm. The nurse must synthesize patient history, symptom presentation, and knowledge of disease processes to formulate a differential diagnosis. Correct approach analysis. The correct approach involves a systematic assessment that prioritizes ruling out serious or emergent conditions, while also considering more common etiologies. This aligns with best professional practice as guided by nursing standards of care and evidence-based practice guidelines for gastroenterology. Specifically, it emphasizes a thorough patient history, including symptom onset, duration, character, aggravating/alleviating factors, and associated symptoms, followed by a focused physical examination. This methodical approach ensures all relevant data is collected, leading to a more accurate diagnosis and treatment plan. It reflects the ethical obligation to provide competent and safe patient care, adhering to the principles of beneficence and non-maleficence. Incorrect approaches analysis. One incorrect approach is to immediately assume the most common diagnosis without a comprehensive assessment. This fails to account for the possibility of more serious underlying conditions that may present with similar initial symptoms. This approach risks delaying critical treatment for conditions like appendicitis, bowel obstruction, or even ischemic bowel, leading to adverse patient outcomes and violating the ethical principle of non-maleficence. It also falls short of professional standards that mandate thorough evaluation. Another incorrect approach is to focus solely on a single symptom without considering the broader clinical picture. For instance, solely addressing nausea without investigating abdominal pain or changes in bowel habits would be insufficient. This narrow focus can lead to symptomatic treatment that masks a more significant underlying pathology, delaying diagnosis and potentially exacerbating the condition. This represents a failure in professional judgment and adherence to comprehensive patient assessment protocols. A third incorrect approach is to rely solely on patient self-diagnosis or anecdotal information without independent clinical assessment. While patient input is vital, it must be integrated with objective clinical findings. Over-reliance on patient-reported diagnoses can lead to misdirection and inappropriate management, potentially causing harm and undermining the nurse's professional responsibility for accurate assessment and care planning. Professional reasoning. Professionals should employ a structured clinical reasoning process. This begins with data gathering, history, physical exam, diagnostic tests. Next, they identify cues and patterns, formulating a list of possible diagnoses, differential diagnosis. They then prioritize these diagnoses based on acuity and likelihood, and select appropriate interventions. Continuous evaluation of the patient's response to interventions is crucial, leading to refinement of the diagnosis and treatment plan. This iterative process, grounded in evidence-based practice and ethical principles, ensures optimal patient outcomes. Question 16. To address the challenge of optimizing patient response to a new proton pump inhibitor, PPI, for severe gastroesophageal reflux disease, GERD, which of the following nursing actions best demonstrates adherence to gastrointestinal pharmacology principles and patient safety guidelines? Option A. Verifying the patient's current medication list for potential interactions with the PPI and assessing for any contraindications or allergies before administration. Option B. Administering the prescribed PPI at the scheduled time without further patient assessment, assuming the physician's order is sufficient. Option C. Administering a PRN as needed, antacid concurrently with the PPI to ensure immediate symptom relief, even if not explicitly ordered. Option D. Educating the patient on the general benefits of PPIs for GERD without inquiring about their specific symptom experience or understanding of the medication. Correct answer is B. Administering the prescribed PPI at the scheduled time without further patient assessment, assuming the physician's order is sufficient. Explanation. This scenario presents a professional challenge due to the critical need for accurate and timely administration of gastrointestinal medications, directly impacting patient outcomes and safety. The nurse must navigate complex pharmacological profiles, potential drug interactions, and individual patient factors. Careful judgment is required to select the most appropriate medication and administration route based on the patient's specific condition and the prescribed regimen. The correct approach represents best professional practice because it prioritizes a comprehensive assessment of the patient's current status, including their gastrointestinal symptoms, medical history, and other medications. This aligns with the fundamental principles of patient-centered care and evidence-based practice, which are cornerstones of nursing ethics and regulatory compliance. Specifically, it adheres to the nursing scope of practice, which mandates that nurses assess patients, plan and implement care, and evaluate outcomes. Furthermore, it reflects the ethical obligation to provide safe and effective care, minimizing the risk of adverse drug events. An incorrect approach that involves administering a medication without a thorough understanding of its pharmacokinetics and pharmacodynamics in the context of the patient's condition is a direct violation of professional standards. This could lead to therapeutic failure, adverse drug reactions, or exacerbation of the patient's gastrointestinal issues. Such an action would contravene regulatory guidelines that emphasize medication safety and the nurse's responsibility to ensure appropriate drug selection and administration. Another incorrect approach, such as relying solely on a colleague's recommendation without independent verification, demonstrates a failure to exercise professional judgment and due diligence. This can lead to the perpetuation of errors and a breach of the nurse's accountability for patient care. It also neglects the importance of consulting official drug references and institutional protocols, which are established to ensure safe medication practices. Professional reasoning in such situations involves a systematic process. First, thoroughly reviewing the patient's medical record and current presentation. Second, consulting reliable pharmacological resources to understand the prescribed medication's indications, contraindications, side effects, and interactions. Third, assessing the patient for any factors that might influence drug efficacy or safety. And finally, administering the medication with appropriate monitoring and documentation. This structured approach ensures that decisions are informed, evidence-based, and patient-specific, thereby upholding professional standards and regulatory requirements. Question 17. Analysis of a patient presenting with a 10-pound unintentional weight loss over 2 months, a history of intermittent nausea and vomiting, and a recent diagnosis of Crohn's disease. What is the most appropriate initial step in conducting a comprehensive nutritional assessment? Option A. Conduct a physical examination focusing on signs of dehydration and edema, as these are common in gastrointestinal disorders. Option B. Order a complete blood count and comprehensive metabolic panel to evaluate for anemia and electrolyte imbalances. Option C. Administer a standardized food frequency questionnaire to quantify macronutrient and micronutrient intake over the past week. Option D. Perform a detailed dietary history, inquiring about the types and frequency of foods consumed, timing of meals, and the impact of gastrointestinal symptoms on appetite and intake. Correct answer is C. Administer a standardized food frequency questionnaire to quantify macronutrient and micronutrient intake over the past week. Explanation. Scenario analysis. This scenario presents a common challenge in gastroenterology nursing, accurately assessing a patient's nutritional status when they exhibit symptoms that can mask or mimic malnutrition. The patient's recent weight loss, coupled with a history of nausea and vomiting, necessitates a comprehensive approach that goes beyond simple weight measurements. The challenge lies in differentiating between actual nutritional deficits, fluid shifts, and the impact of the underlying gastrointestinal condition on nutrient absorption and intake. A superficial assessment could lead to misdiagnosis, delayed intervention, and suboptimal patient outcomes, potentially violating standards of care. Correct approach analysis. The correct approach involves a multifaceted nutritional assessment that integrates subjective and objective data, aligning with best practices in gastroenterology nursing and ethical obligations to provide competent care. This includes a detailed dietary history to understand intake patterns, a review of gastrointestinal symptoms and their impact on digestion and absorption, and a physical examination to identify signs of nutrient deficiencies. Furthermore, considering relevant laboratory values, e.g., albumin, prealbumin, electrolytes, provides objective markers of nutritional status. This comprehensive strategy ensures that the assessment is thorough, evidence-based, and tailored to the individual patient's complex presentation, thereby upholding professional nursing standards and patient advocacy. Incorrect approach is analysis. Focusing solely on recent weight loss without considering the contributing factors, nausea, vomiting, underlying GI condition, is an incomplete assessment. This approach risks misinterpreting fluid loss as pure fat or muscle wasting, leading to an inaccurate nutritional diagnosis and potentially inappropriate interventions. It fails to address the root causes of the weight loss and the patient's symptoms, which is a failure in comprehensive patient care. Relying exclusively on a single laboratory value, such as serum albumin, without a broader nutritional assessment is also problematic. While albumin can be an indicator of nutritional status, it is also affected by inflammation, hydration status, and liver function, making it an unreliable sole marker. This narrow focus can lead to misinterpretation of the patient's overall nutritional health and delay necessary interventions. Ignoring the patient's reported symptoms of nausea and vomiting, and proceeding with a standard dietary recall without acknowledging their impact on intake is a significant oversight. These symptoms directly impede the ability to consume adequate nutrients and can lead to malabsorption. Failing to account for these symptoms means the dietary history will not accurately reflect the patient's actual nutritional intake and needs, thus compromising the assessment's validity. Professional reasoning. When faced with a patient exhibiting symptoms that can complicate nutritional assessment, a professional nurse should employ a systematic and holistic approach. This involves 1. Actively listening to and validating the patient's reported symptoms and concerns. 2. Gathering a comprehensive history, including dietary intake, gastrointestinal symptoms, medical history, and social factors influencing nutrition. 3. Performing a thorough physical examination, looking for signs of malnutrition. 4. Reviewing relevant laboratory data in conjunction with clinical findings. 5. Collaborating with the interdisciplinary team, physicians, dietitians, to develop a tailored nutritional plan. This decision-making process prioritizes patient-centered care, evidence-based practice, and adherence to professional nursing standards. Question 18. The efficiency study reveals that a patient undergoing treatment for a complex gastrointestinal motility disorder, potentially impacting their enteric nervous system signaling, is verbally agreeing to a new medication regimen. However, the Certified Gastroenterology Registered Nurse, CGRN, observes subtle cues suggesting the patient may not fully grasp the implications of the treatment, including potential side effects and the long-term management strategy. The CGRN must decide how to proceed to ensure ethical and effective patient care. Option A. Proceed with the medication regimen as the patient has verbally consented, documenting their agreement. Option B. Administer the medication as prescribed, explaining that it is a standard treatment and further discussion can occur later. Option C. Immediately involve the patient's family to obtain consent for the treatment, assuming the patient lacks full capacity. Option D. Engage in a more in-depth discussion with the patient, using simplified language and visual aids to assess and enhance their understanding before proceeding. The correct answer is A. Proceed with the medication regimen as the patient has verbally consented, documenting their agreement. Explanation. Scenario analysis. This scenario presents an ethical dilemma for a certified gastroenterology registered nurse, CGRN, regarding patient autonomy and informed consent when a patient's neuroanatomy of the enteric nervous system, ENS, may be compromised, potentially affecting their ability to fully comprehend complex medical information. The challenge lies in balancing the need to provide essential care and treatment plans with the ethical obligation to ensure the patient understands and consents to these plans, especially when their cognitive capacity or sensory processing related to gut-brain communication might be impaired. The ENS, often termed the second brain, plays a crucial role in digestion, nutrient absorption, and even influences mood and behavior through its intricate neural network. A disruption in this system, whether due to disease, medication side effects, or underlying neurological conditions, could subtly impact a patient's perception of their symptoms or their ability to process information about their condition and treatment options. Correct approach analysis. The correct approach prioritizes patient autonomy and informed consent, which are foundational ethical principles in healthcare, particularly for registered nurses. This involves a thorough assessment of the patient's understanding, utilizing clear and simple language, and employing alternative communication methods if necessary. The CGRN must ensure the patient comprehends the risks, benefits, and alternatives of the proposed treatment, even if their ENS function might be influencing their perception or processing. This aligns with the American Nurses Association (ANA) Code of Ethics, which emphasizes the nurse's responsibility to advocate for patients and ensure their right to self-determination. Specifically, Provision 1. 1. Respect for autonomy and Provision 1. 2. Truth-telling and honesty are directly applicable. The nurse must actively seek to understand the patient's perspective and any potential barriers to comprehension, rather than making assumptions. Incorrect approaches analysis. One incorrect approach involves proceeding with the treatment plan without adequately verifying the patient's comprehension, assuming that because the patient verbally agrees, they fully understand. This violates the principle of informed consent and the nurse's ethical duty to ensure comprehension. It fails to acknowledge the potential impact of ENS dysfunction on cognitive processing or sensory interpretation, which could lead to a situation where consent is not truly informed. This could be seen as a breach of professional responsibility and potentially lead to patient harm if the treatment is not understood or if the patient is unable to articulate their true wishes or concerns. Another incorrect approach is to unilaterally decide that the patient lacks capacity and proceed with a surrogate decision-maker without a formal assessment or attempting to facilitate the patient's own decision-making. While surrogate decision-making is a necessary component of care when a patient truly lacks capacity, it should be a last resort. The nurse has an ethical obligation to explore all avenues to support the patient's decision-making capacity first. This approach bypasses the patient's fundamental right to participate in their own care as much as possible, which is a violation of their autonomy. A third incorrect approach is to oversimplify the information to the point where critical details about the treatment, including potential side effects or the rationale behind the intervention, are omitted. While clarity is essential, the omission of pertinent information prevents the patient from making a truly informed decision. This can be interpreted as a failure of truth-telling and can undermine the patient's trust in the healthcare provider. Professional reasoning. When faced with a situation where a patient's ENS neuroanatomy might influence their comprehension, a CGRN should employ a systematic decision-making process. First, conduct a comprehensive assessment of the patient's current understanding of their condition and the proposed treatment. This includes asking open-ended questions to gauge their grasp of the information. Second, use clear, concise language, avoiding medical jargon. Employ visual aids or written materials if appropriate. Third, actively listen to the patient's responses and observe their nonverbal cues for any signs of confusion or distress. Fourth, if there are concerns about comprehension, explore potential contributing factors, including the impact of their gastrointestinal condition on their overall well-being and cognitive processing. Fifth, if comprehension remains a significant concern, involve other members of the healthcare team, such as a physician or a patient advocate, to assist in the assessment and communication process. The ultimate goal is to ensure that the patient's consent is informed, voluntary, and based on a genuine understanding of their healthcare choices. Question 19. The monitoring system demonstrates that a patient diagnosed with peptic ulcer disease has repeatedly refused the prescribed proton pump inhibitor, citing a vague concern about feeling funny after taking it previously. The nurse needs to address this situation ethically and professionally. Which of the following actions best upholds the patient's rights and promotes their well-being within the regulatory framework for certified gastroenterology registered nurses? Option A. Document the patient's refusal and inform the physician, but do not engage further with the patient regarding their concerns about the medication. Option B. Advise the patient that their concerns are likely unfounded and that they must take the medication to avoid severe health consequences. Option C. Engage in a detailed conversation with the patient to explore their specific feeling funny symptoms. Re-educate them on the importance of the medication for preventing serious complications of peptic ulcer disease, and assess their capacity to refuse treatment. Option D. Administer the medication as prescribed, as the potential for serious complications like bleeding outweighs the patient's stated discomfort. The correct answer is D. Administer the medication as prescribed, as the potential for serious complications like bleeding outweighs the patient's stated discomfort. Explanation: scenario analysis. This scenario presents an ethical dilemma where a registered nurse must balance patient autonomy, the principle of beneficence, and the potential for harm. The patient, diagnosed with peptic ulcer disease, is refusing a prescribed medication that is crucial for managing their condition and preventing serious complications. The challenge lies in respecting the patient's right to refuse treatment, while also fulfilling the nurse's professional responsibility to promote the patient's well-being and prevent foreseeable harm. This requires careful communication, assessment of the patient's understanding, and exploration of the underlying reasons for refusal, all within the scope of professional nursing practice and ethical guidelines. Correct approach analysis. The correct approach involves a thorough assessment of the patient's understanding of their condition, the prescribed medication, and the potential consequences of non-adherence. This aligns with the ethical principle of informed consent and patient autonomy, as well as the nursing standard of care which mandates patient education and advocacy. By engaging in open communication, exploring the patient's concerns, and re-educating them about the risks of untreated peptic ulcer disease, such as bleeding, perforation, or obstruction, the nurse upholds their duty to beneficence. Documenting the patient's refusal and the interventions taken is also a critical professional and regulatory requirement. Incorrect approaches analysis. One incorrect approach involves overriding the patient's refusal and administering the medication without further discussion or consent. This violates the ethical principle of patient autonomy and the legal right to refuse medical treatment. It also constitutes a breach of professional conduct and could lead to legal repercussions. Another incorrect approach is to simply document the refusal and take no further action. While respecting autonomy is important, a nurse has a professional and ethical obligation to assess for understanding and potential harm. Abandoning the patient's care by not exploring the reasons for refusal or attempting to mitigate risks would be a failure of the nursing duty of care and could be considered professional negligence. A third incorrect approach is to dismiss the patient's concerns as unfounded without proper investigation or explanation. This demonstrates a lack of empathy and respect for the patient's perspective, hindering the therapeutic relationship and failing to address the root cause of the refusal. It also neglects the nurse's responsibility to ensure the patient is making an informed decision. Professional reasoning. Professionals should approach such situations by first prioritizing patient safety and autonomy. This involves active listening, empathetic communication, and a commitment to patient education. The decision-making process should follow a structured approach. 1. Assess the patient's understanding of their diagnosis, treatment options, and the implications of their choices. 2. Explore the patient's reasons for refusal, addressing any fears, misconceptions, or barriers to adherence. 3. Provide clear, concise, and accurate information about the benefits of the medication and the risks of non-treatment, tailored to the patient's level of understanding. 4. Involve other members of the healthcare team, such as the physician or pharmacist if necessary, to provide further clarification or support. 5. Document all assessments, interventions, patient responses, and decisions thoroughly. 6. Respect the patient's final decision, provided they have the capacity to make it, and continue to provide supportive care. Question 20. What factors determine the appropriate use of antibiotics in a patient presenting with acute diarrhea and abdominal pain, considering the potential for gastrointestinal infection and the principles of antibiotic stewardship. Option A, the availability of broad-spectrum antibiotics in the facility's formulary and the perceived urgency to initiate treatment to avoid patient dissatisfaction. Option B, the patient's clinical presentation, including the presence of fever, blood or mucus in stool, severity of symptoms and recent travel history, alongside diagnostic test results and established guidelines for antibiotic use in specific infections. Option C, the patients and families expressed desire for immediate symptom relief and a preference for a specific antibiotic, regardless of diagnostic findings. Option D, the nurse's personal experience with similar cases and a general understanding that antibiotics are often prescribed for gastrointestinal upset. The correct answer is B, the patient's clinical presentation, including the presence of fever, blood or mucus in stool, severity of symptoms, and recent travel history, alongside diagnostic test results and established guidelines for antibiotic use in specific infections. Explanation: this scenario presents a common ethical dilemma in gastroenterology nursing, balancing the immediate need to treat a suspected gastrointestinal infection with the long-term implications of antibiotic stewardship and patient autonomy. The challenge lies in navigating patient and family expectations, the evolving clinical picture, and the evidence-based guidelines for antibiotic use. The correct approach prioritizes a thorough diagnostic workup and judicious antibiotic selection based on clinical presentation and potential pathogens, aligning with best practices in infection control and antibiotic stewardship. This approach respects the principle of beneficence by aiming for effective treatment while minimizing harm, e.g., antibiotic resistance, c. difficile infection, and upholding professional responsibility to use resources wisely. It also adheres to ethical principles of non-maleficence and justice by ensuring appropriate care for the individual and contributing to the broader public health goal of combating antimicrobial resistance. Regulatory frameworks and professional guidelines for nursing practice emphasize evidence-based decision-making, patient safety, and ethical conduct. An incorrect approach that immediately prescribes broad-spectrum antibiotics without adequate diagnostic investigation fails to uphold the principle of non-maleficence. This can lead to unnecessary exposure to side effects, contribute to the development of antibiotic resistance, and potentially mask or complicate the diagnosis of the underlying cause. Ethically, it deviates from the standard of care and may not be the most effective or safest course of action. Another incorrect approach that defers entirely to patient or family demands for specific antibiotics, even if not indicated, violates the nurse's professional responsibility to provide evidence-based care and act in the patient's best interest. This approach prioritizes patient satisfaction over clinical judgment and can lead to inappropriate treatment, potential harm, and a failure to adhere to professional standards and regulatory requirements for safe and effective nursing practice. It undermines the nurse's role as a patient advocate and educator. A third incorrect approach that focuses solely on symptom relief without addressing the potential infectious etiology overlooks the core issue and the role of antibiotics in managing certain gastrointestinal infections. While symptom management is crucial, failing to investigate and treat the underlying cause, if infectious, can lead to prolonged illness, complications, and the spread of infection. This approach neglects the principle of beneficence and the nurse's duty to provide comprehensive care. The professional decision-making process in such situations involves a systematic assessment of the patient's condition, consideration of differential diagnoses, consultation with the healthcare team, adherence to institutional policies and evidence-based guidelines, and open communication with the patient and family. It requires critical thinking to weigh the risks and benefits of various interventions, including the judicious use of antibiotics, and to advocate for the most appropriate and ethical course of action.